officer in Dhanvantri Psychiatry Hospital, Kolar, and also as a mental health counselor. I did my MBBS from GMC Mumbai, and after that I have done PG Diploma in Integrative Counseling. Okay, so here are the few discussion topics that we will be dealing. Introduction, types of eating disorders, causative factors, and a small management. Okay, so as we all know that eating disorders are basically which is presented along with some comorbidities or some background disease or as a independent disorder. So around 2 to 3% of the population in India suffer from the eating disorder, and it is more common in females. It may be genetically or naturally because of the body image issues that the females have. We should know that these eating disorders are very serious and fatal kind of illnesses. It is associated with the disturbance in the eating pattern of a person, or thoughts and emotions, the stress level that they go through. In this issue, in this eating disorders, the patient is usually preoccupied with the thought of food, weight, body image, and body shape. So there are 4 types of common eating disorder that we see. First is anorexia nervosa, bulimia nervosa, binge eating disorder, and avoidant restrictive food intake disorder. So first we'll be seeing anorexia nervosa. I think in like many diseases like cancer only, we usually see the patient who are cachexic and suffer from anorexia. In kind of joking also we say अरे यार खाता नहीं है इसको तो anorexia हो गया है, ठीक है. So in this condition, it is a very serious condition. In this condition, people usually avoid food. They restrict the amount of food they take. Even if they eat food, they try to just remove it out from the body. They are very much preoccupied with the weight, so they keep on repeatedly weighing their body. Even though they are very cachexic, they see themselves as overweight. So because of that, they have that mindset that even the like a small amount of food will increase their weight drastically. So these are the 2 subtypes of anorexia nervosa. One is restrictive and one is binge purging. In restrictive, they typically limit the amount of food and they are very picky towards the choice of the food they consume. And binge purging is where they restrict the amount of food and the type of the food, but along with that, they just purge it. Like binge eating is eating a particular amount of food, and then purging is removing the food out of the body by self-inducing vomiting, using laxatives or diuretics. So the few symptoms or the warning signs you can see, you'll be able to see in the patients with anorexia is extremely restricted eating, emaciation, that is loss of muscle, then unwillingness to maintain a healthy weight. Even if you will counsel them or tell them, they will never agree to maintain a healthy weight. They have an intense fear of gaining weight. They have a distorted body image, like even though they are quite thin, they have a very low BMI, still they feel like they are quite obese or overweight. They are in the denial for the seriousness of the low body weight. Also, what we see is they maintain at least less than 15% of the they lose 15% of the body weight, and their BMI is usually 17.5 or less than that. So these are the few other symptoms that you see in the patient with anorexia nervosa. They suffer from constipation. They have quite hormonal imbalances because of which they suffer from amenorrhea, and as they don't have a proper amount of fluid intake and all, also they use diuretics because of which they suffer from dehydration. They have low blood pressure, dry skin because of dehydration. You'll be seeing a thin golden color hairs, which are called as lanugo, that is usually seen in newborn babies. Then insomnia, giddiness or fainting. Next. Like in bulimia nervosa, they eat a particular, like a large amount of food, and after that they do purging, like by self-inducing vomiting or excessive exercise they do. Like they are whole day, there are people who keep on exercising for 8 hours, 10 hours, and they are not necessarily underweight. They might be underweight, normal, or maybe overweight. So the common symptoms or the warning signs that we see in the patients of bulimia is eating a large amount of food at a time. Later on, after eating food, they experience feelings of guilt, shame, and anxiety. The guilt that they have eaten so much, but they are preoccupied with the thought of losing weight, because of which they induce vomiting, they use laxatives, they do excessive exercises, and yeah. So the other symptoms again that you see is somewhat similar to the anorexia nervosa. So they have a fear of gaining weight, anxiety, low self-esteem. They are usually, you will see these patients having a background psychiatric disorder such as anxiety or depression in them. Then dehydration, then heart failure. They may suffer from the heart failure. Also because of the disturbed food eating habits, they may have constipation, irregular bowel movements. Then they must be suffering from iron deficiencies or anemia, hormonal disorders, growth hormone disorders. Then because of the vomiting, you will be mostly seeing that as they self-induce the vomiting part, you will be seeing erosions over the teeth and the knuckles. The soreness of the throat because of continuous vomiting, and the tooth enamel is eroded. They have sensitive tooth. Then they might have blood and vomiting because of the repeated vomiting. Then muscle fatigue, ulcers, pain, and yes, dehydration and electrolyte imbalance. This is another kind of eating disorder, that is binge eating disorder. I think dietitians usually come across this kind. This is the most common disorder that dietitians come across. I think we all have also faced this binge eating disorder, especially during our PMS phases. So binge eating disorder is the eating a large amount of food and losing the control over the food. The difference between binge eating and bulimia is, in bulimia, the binge eating is followed by purging, that is using laxatives and all. But in binge eating disorder, there is no purging. It is not followed by purging or exercise or fasting. Although the patient has that constant feeling of guilt, it is kind of a cycle. Okay, usually seen in depression or something, to get rid of their or kind of coping skills for their stress. They keep on eating, eating and then they gain weight, and they have that body image issues, they have low self-esteem. Again, they face the guilt and all, and now to cope up with that emotion, again they eat a lot, and this is a cycle that we usually follow. This is another kind of very common eating disorder usually seen in children and the like middle-aged young adolescents or the school-going children. Avoidant restrictive food intake disorder. Usually this is seen in the young age only, and normally child is usually picky about their food. But in this case, they are picky, even in the middle childhood, they are very picky about, they choose the food usually that have very less amount of calories. In this kind of food eating disorder, patients are not very much preoccupied with the thought of body image issue. Okay. So the few warning signs and symptoms are patient. Usually these children, you will be seeing that they keep on complaining, having multiple somatic complaints because they don't want to eat. They usually complain of abdominal pain, मम्मा वॉमिटिंग आ रही है, नहीं खाना है, पेट दुख रहा है, नहीं खाना है, बुखार आ रहा है, नहीं खाना है. Okay, so these are the patients usually in the adolescent period. They are being bullied or something in the college, in the school, or in their childhood, or because of the family members also. They have that pressure of maintaining a body image. So because of that, they usually get picky in their food habits. Okay. These are the common causative factors for all type of eating disorders: biological, behavioral, psychological, social, and interpersonal. So the psychological common factor we usually see is the patient with the low self-esteem. As I said, they are usually suffering from anxiety and depression, and they have low self-esteem, and because of that they kind of have developed guilt, and to cope up with that stress they usually eat a lot. Then stress sports, like usually you will be seeing these eating disorders very common in athletes and all, who are very much involved in the high physical activity. Also in the transition phase, like puberty, when a person attains puberty, they have hormonal changes, very much psychological changes, body image issue, all the media pressure from the social media and all, because of which they restrict eating. Depression, impulsiveness, yes, impulsiveness, it is one of the kind of stress eating. Trauma, because of which they face, like the physical trauma, emotional trauma, or the most common trauma that they usually suffer from is the sexual trauma, like child sexual abuses. They are not able to express their emotions in front of anyone, because of which they try to keep things to themselves. And it is also one of the things that they feel like the high carb diets actually, they help them to, it helps to lower down the stress level. Okay, some biological factors is like the binge eating pattern especially and all, you will see that it is seen in the family. We teach, kind of they see us, like the children, they see their adults and all, their parents seeing that okay, they are feeling bad, so they have chocolate. We usually say, अरे बेटा उदास नहीं हो, मन अच्छा नहीं लग रहा, लो chocolate खा लो थोड़ी सी, केक खा लो, अच्छा लगेगा. So kind of these are like we have inculcated this in our family. This is genetic, very common in first degree relatives, and also few of the neurochemistry, like the hormones, neuropeptides and dopamine, serotonin, and other neurochemicals which are responsible for the eating disorders. The social and the cultural factor, I think this is the most commonly what we see nowadays is the diet culture, intermittent fasting, keto diet. It is not like we are not against the diet culture, but the thing is usually most of them, they don't consult a dietitian or any specialist for the diet culture. They see the YouTube video, they don't know how much amount of food or the calories they should consume. They think, especially for the intermittent fasting, कि 14 घंटे का गैप होना चाहिए मिनिमम इंटरमिटेंट फास्टिंग में, बट दे डोंट नो कि वो जितना टाइम खा रहे हैं उसमें वो कितना अमाउंट ऑफ कैलोरी लेंगे. So because of which they usually go into that phase. Okay. Another thing is that they see कि हाँ चलो सबके सामने जा रहे हैं, खाने का मन करता है, फूडी है, बट सबके सामने कैसे खाए, शर्म आती है ना. ये ऐसे होता है यूजुअली लड़कियां जब फर्स्ट डेट पे जाती है. आई हैव एक्सपीरियंस विद माई सेल्फ, बाय द वे ही इज़ माई हस्बैंड. सो ये यूजुअली होता है कि कैसे खाएं, फिर जाने के बाद में केक अरे पार्सल ले लेते हैं, घर जाकर खाते हैं. So this is usually seen in the children, adolescent children also, कि सबके सामने वो खाते नहीं हैं, but they have that urge and all. Especially when you will restrict that thing, तो उनको और ज़्यादा urge होगी, तो वो जाके छुपा छुपा के खाते हैं. तो आप अगर उनके rooms में देखोगे, उनके bags में देखोगे, they have packets with them. They always carry those kind of packets. Peer pressure, yes, peer pressure of look thin and slim and don't know what. Family values, there are especially seen in the people of high socioeconomic status. They have that continuous pressure of maintaining a particular style, a particular body shape to present themselves in front of others. Bullying, yes, bullying is also one of the very common thing that we see usually in teenagers. Interpersonal factors is like having a troubled family and the personal relationships. These are all kind of trauma that they face, and eating disorders, or like either they stop eating or they eat a lot. This is kind of a coping skill, you can say. And body shaming, yes, and also the physical or the sexual abuse that they face. So the treatment, it doesn't only consist of just the medical treatment or something. It is a kind of a teamwork that we need to manage the patients with the eating disorder. They need a doctor, yes, psychiatrist. They need basically the who deal with the mental health, because eating disorder is an independent psychiatric illness. Therapist to like give them a few exposure or the motivational tips, and dietitians to tell them or give them a proper nutritional counseling. So these are the few therapies. I won't go in detail about the therapies much. The family-based therapy, usually this is the therapy that we give not only to the patient but all the family, and they need a proper family support to get out of this eating disorders. Not just the patient, but we need to educate the family also to motivate them to have a healthy diet. Cognitive behavioral therapy is usually seen in the patients with depression and all, who suffer from this guilt, body shaming, low self-esteem, where cognitive behavioral therapy is helpful. Exposure therapy is usually given to the patient who have obsessive traits. You must have seen patients who are having this obsessive signs and symptoms, like continuously washing their hands, continuously they keep on checking things कि दरवाजा बंद है कि नहीं. These are few of the obsessive traits जो कि OCD वाले patients में दिख सकता है या दूसरों में भी just एक trait की तरह as a sign दिख सकता है. These are usually the people who are very perfectionist. तो उनको वो body maintain, weight maintain करने का perfectionism का भूत सवार रहता है. तो they keep on, उनके लिए exposure therapy बहुत helpful रहता है. Exposure is not like giving them a little bit of exposure. पहले हम थोड़ा सा weight gain करेंगे, थोड़ा सा weight gain करेंगे, and then the complete healthy diet. Support groups are usually for the, we can involve patients who were suffering from the eating disorders and who have been recovered, and they can act as a guide and the motivational speaker or something for the patient suffering from eating disorders. Next. Self-help, we can always help or motivate the patient to keep a diary of how much food they eat, of the thoughts, emotions and the situations they go through. Probably we can teach them a different kind of coping skills instead of this binge eating and all. We can ask them to have to read a self-improvement book or learn about the nutrition, or take help of a nutritionist or some mental health specialist. Nutritional counseling, this is the one where the dietitians come into picture. We as doctors also, we usually don't have much knowledge about nutrition. So nutrition, we as like according to the weight and the height, what kind of proper nutrition is to be given. We need to educate not only to the patient but to the family, especially the parents of the young adolescents, or the spouse or someone, or family members, to advise the proper nutrition. These are few of the medical care that can be given. As I said, that eating disorder is one of the is an independent disorder. It is also associated with many psychiatric illnesses like depression, anxiety, schizophrenia. Usually not much in psychosis, but yes, the depressive part and anxiety, it is usually seen. So we can treat those conditions with the use of psychotropic drugs like antidepressants. antipsychotics or mood stabilizers. Eating disorders are also very commonly associated with the high suicide rate. So we should not neglect this condition, because you might see that because of the guilt, or even if you'll force, or if you'll see that if the patient is being forced by the family, or khao khate nahi ho, sometimes they feel so much of guilt that they might commit suicide. So it is a very serious illness to be taken care of. Treatment of other severe life-threatening complications like electrolyte imbalance, severe dehydration, then hormonal imbalances. You will also see that in the diabetic patients, when they are not asked to eat, they have that continuous fear of continuous fear of being a diabetic patient, and they stop eating completely the diet, and they take diet in an improper way, or because of that craving they start overeating. Then dental cavities and dental erosion, as I said, it is because of the self-inducing vomiting or the hyperacidity because of the purging and all, and osteoporosis. Okay, so concluding with it, we all know that there are many psychiatric issues that usually we face in day-to-day life. You will come across many people, especially as a dietitian, ज़्यादा करके overweight लोग ही आते हैं, and अगर आप उनका background story सुनेंगे तो it will be like कि मुझे बहुत टेंशन होता है, कुछ ना कुछ स्ट्रेस फैक्टर रहता है कि they keep on binge eating, especially the sweets, chocolates and cakes and all, especially in the young females you will see. So it is not just about, I have myself gone to people okay PCOS वगैरह के लिए, they just advise कि ये डाइट ले लो, न्यूट्रिशन ले लो, हो जाएगा, तुम्हें फॉलो करना है. But it is not easy. It is not at all easy, because it's not just about the nutritional part or the food craving. It is about their thought and emotions. You need to evaluate the thought and emotions they have behind their eating pattern. Okay, there's sometimes they might be having like quite craving. They might not be that much free to eat in front of people, और छुपा छुपा के वो और ज़्यादा खाने लग जाते हैं. Then they puke, they purge it out, all the food and all. Nutrition तो कहीं मिला नहीं, psychological damage हुआ वो अलग. So just giving like even after when you take a follow-up, we usually see that there are very like too many roadblocks for the person following the nutrition, the diet plan what you give. Okay, so you should not just follow, अरे यार ये तो करता नहीं है, इसको देख के क्या मतलब है. No, please try to evaluate the basic stress factor behind this eating patterns and all. So okay, if you will see any kind of patients with this kind of eating disorders, just being focused on one part of the diet plan, please look for the basically we all are, I have seen that dietitians में mostly females होती हैं, and females are like they have that kind of empathy towards the children or the females or other, as it is very commonly seen in females. So just try to express and try to evaluate their emotions, and accordingly along with the diet part, if you ever feel that the patient is having any kind of stress or disturbances or any kind of psychological or psychiatric issue, please refer to them to a mental health specialist. Thank you.